Hello, my name is Dr. Lilly. Today I will show you a few different easy ways to stretch hip flexors. Hip flexor muscles, or iliopsoas muscle, is a muscle that actually connects your hips on the front and your back, and it can limit your hip and back range of motion. It can actually cause quite a bit of shearing of the spine in case of tightness, and it can actually even increase the level of cortisol production, causing accumulation of the belly fat. So how to stretch hip flexors? So hip flexors can be stretched in standing position, can be stretched in kneeling position, and can be stretched supine or laying down face up. So I'll show you a few different stretching exercises, in standing position. And the first stretching exercise is simply standing with the leg back, knee slightly bent, heel off the floor, keeping belly nice and tight, chest up. And in this position, actually, you should feel stretch on the front of your hip. So you should hold this stretch for 30 seconds or 10 deep breaths. And then you should switch and do the same on the opposite side and alternate left and right 3 times and hold 30 seconds for 30 seconds or 10 deep breaths. The second stretching exercise in a standing position is lifting the leg up on a chair, or in this case I have this bench, and then leaning forward to open up the hip. So you should feel a good stretch on the front of the hip with this stretching exercise. So the third stretching exercise is actually putting the knee on a bench, or it can be even on a chair like this, and then stepping forward to open up the hip. Again, belly should be nice and tight, tail should be tucked in, chest open, lean forward. You should feel a good stretch there. And in some cases, if you can tolerate that, lifting the arm up and leaning slightly back should even more increase stretching of the hip flexor. So with both of those exercises, you should hold 30 seconds and repeat 3 times on each side. So hip flexor stretch can be done also in a kneeling position. So in a kneeling position, I like to use some kind of pillow or a mat, just to pad the knee. And you put the knee down, and then you step forward, keep belly nice and tight, and open up your hip, and hold there for 30 seconds. And then do the same on the other side. So lean forward, keep belly nice and tight, open up, hold for 30 seconds. In this position also, you can do arm over to stretch a little bit more. With this stretching exercise, you also alternate left and right 30 seconds and repeat 3 times. So other than those stretching exercises, you can do stretching also laying on a bed, face up. And with this stretching exercise, we actually scoot to the edge of the bed and drop the leg off the edge of the bed while holding pelvis nice and tight. So lastly, I will show you how to stretch hip flexors in supine position, or laying on your back face up. So this position is actually used for patients or individuals who actually cannot tolerate any other position. They cannot kneel on their knee, or they cannot stand to stretch their hip flexors, or they have simply too much pain in their back, hip, or knee, or they have some balance issues. So this exercise is done by laying on a bed and scooting all the way to the edge of the bed and then dropping one leg off the side. So I'll hold this position for 2 minutes, and while you're keeping your belly nicely tucked, you should actually have a long, nice and prolonged stretching to avoid changing position too many times. So when you're done with stretching on that side for 2 minutes, you should actually scoot on the other side and drop your leg on the other side, or just rotate and drop the leg off the edge on the other side and hold there for 30 seconds. Make sure you're keeping your belly nice and tight. Otherwise, if you let your hip flexor pull you forward in anterior pelvic tilt position, you don't going to feel the stretch. Okay, so thank you very much. Bye.